Welcome to my channel Nurse Educator. In today's video, let us learn about Introduction to Midwifery and Historical Review of Midwifery in India. Midwifery is a healthcare profession which deals with care of mother during pregnancy, labor and postpartum period. So midwifery is nothing but it is a healthcare profession. Here a midwifery, the person who is caring the mother in the sense during pregnancy, when she is pregnant, in the prenatal antenatal visits she is caring the pregnant woman, and during labor, during the delivery time she is caring the woman, and also after the delivery she is caring the woman in the postpartum period. The practitioners of midwifery are known as midwives. The word for midwifery who are practicing it is known as midwives. For both women and men it is referred same. Historically, midwives have always been around to help women give birth. From olden times, not today we'll call it as a midwife, but from olden times, from early historic views, we'll see these midwives have always been around of the woman to give, and they are helping and assisting that woman to give birth. Before physicians, midwives are called as the primary healers in the community. Primary healers, why they are called as primary in the sense? Because they are helping in prenatal, antenatal visits, they are supporting during the deliveries, also in the postpartum. So that's why they are primary healers. Then we'll see the word obstetrics. The word obstetrics is a branch of medical science which deals with complications of pregnancy, labor and postpartum period. Obstetric is nothing but it is a branch of medical science which is dealing with complications, complicated pregnancies. What are the complications during the labor, or even the complications in the postpartum period? Like complication in the sense, some women might have high risk pregnancies. She might have some other disease conditions or some related to pregnancies, like hypertension, like diabetes, like HIV. So these conditions they are dealing in the obstetrics. Even during labor, like big baby is there, or breech presentation is there, cephalopelvic disproportion is there. So during those conditions they are handling, like they are conducting the cesarean sections. And also in postpartum, like the woman might have postpartum hemorrhage or any other problems or any other complications can be handled by this obstetrician. Both midwife and obstetricians are trained to care pregnant women and assist them during their deliveries. These both are trained to care the pregnant women during their deliveries. But here we see what is the difference between them both. The midwife will have more holistic approach. Why she is having holistic approach? Because she is caring the pregnant woman. Generally she spends more time with the woman during her visits, and also she supports during her labor and also in the postpartum period. So that's why she is having holistic approach. And here obstetricians performs the cesarean sections and any other necessary surgical procedures. So here, whereas they are having more medical approach to the obstetrical care, in general we can also say they are having less hand-on approach to labor and delivery. Then we'll see what is the midwife etymology. Etymology is nothing but here we see how the meaning of the word midwife has changed from time to time. From olden times to now, how they have changed the word midwife. The word obstetric was the Latin word for midwife. Obstetric is a Latin word for midwife, though it is derived from obstere. Obstere means to stand before. Before the person will stand before, and because the birth attendant stood in front of women. That's why they have given this word obstetric. Okay, so when this word have changed, okay, only in the 20th century the subject was taught in medical schools. Okay, in medical schools they taught this subject. From midwifery they have changed to obstetrics. Okay, they have changed it to obstetrics, and its Latin name seemed more academic. Okay, this obstetric name was seeming more academic than the Anglo-Saxon name. Okay, the Anglo-Saxon name is nothing but midwife. Okay, what is the meaning of midwife? With woman. Then we'll see what is the definition of midwife. Okay, according to International Confederation of Midwives, a midwife is a person. Okay, a midwife is a person who has regularly admitted to medical educational program. She is admitted to medical educational program that is duly recognized in the country. Okay, which is recognized in her country where she is located, where she is being staying. Okay, and has successfully completed the prescribed course of studies in midwifery. She has completed her course in midwifery and has acquired the requisite qualification to be registered, and she is legally licensed to practice midwifery. Okay, she can also practice midwifery legally. Okay, this is the definition of the word midwife. Then International Midwives Day was first celebrated on May 5th, 1991 and has since observed in over 50 nations around the world. Okay, as everybody we know that the first International Midwives Day was celebrated on May 5th, 1991. Okay, then we'll see the next topic, that is historical perspective of midwifery. Okay, how historically the midwifery has been, from the historic view, how it has been evolved. Okay, from olden times, from early historic view, how it has changed, and what we are in India, how the midwifery is being practiced. Okay. The history of midwifery is a very long and interesting one. Okay, women of all countries have done noble work as midwives throughout the world. Okay, the midwives over all the world have done a very noble work. Noble work, that means it is a very professional work, right? To help a woman to help the woman during delivery is a very noble work. As midwives throughout the world, they have done this noble work. Okay, so Socrates' mother was a midwife, and he considered it as a most respected profession. Socrates called this profession as a very respected profession, and also according to Aristotle, a midwife is a most necessary and honorable officer. Okay, and also Aristotle also is saying that midwifery is the most necessary and honorable officer who is here this midwifery is being a helper of nature. Okay, she is naturally she is having that ability to help the woman. Okay, midwife carries a huge responsibility. Though the person who is conducting a labor or delivery, she has a very huge responsibility in helping the woman during the delivery and also in receiving the baby. Okay, we'll see how midwifery in India was practiced before independence. In ancient time, there were indigenous dais. Okay, there were dais who practiced midwifery. Okay, dai is nothing but a woman who has already delivered more than 4 to 5 children, and now she is having more experience in delivering or in helping other women to deliver the baby. Okay, and cared for laboring women. Okay, these indigenous dais cared the women during the labor. Even today, most deliveries in rural India are conducted by indigenous dais, and these dais, they are not having any formal training. Okay, they are not trained women they are only experienced because they have given birth to more than 4 or 5 children, so that's why they are having no formal trainings. But during the British rule, the status of women was very poor. Okay, why it was very poor? Because the maternal and neonatal mortality rate was very high. Maternal and neonatal, that means women who is delivering, her mortality death rate and also the newborn death rate was very high in India. So the medical missionary women from England came to India and observed that infant mortality rate in India is very high. Okay, that time in the British rule it was approximately 400 deaths per 1000 live births as compared to Britain. Britain was having 60 infant mortality in 60 deaths per 1000 live births. So comparing to Britain, India's mortality rate was very high. So therefore they concluded, the missionary women or the England women concluded that it is most mandatory need in healthcare was for maternal and child welfare care. Women missionaries missionarians made efforts to train these dais. Okay, because dais were not having any formal training, so that's why this missionary women helped or trained the dais for conducting the labor. Okay, the training is very important for the eyes, because if there are any complications they will not know what to do during the delivery, so that's why training is very important. So they started those training for the eyes. The first training school for the eyes was started by Miss Hewlett, an English missionary of Zana in 1877. Okay, in the year 1877 the first training school for the eyes was started by an English missionary. In 1926, Madras Registration of Nurses and Midwifery Act was passed. Okay, in the year 1926, the Registration of Nurses and Midwife Act was passed. It promoted registered midwifery practices. Okay, they started the registered midwifery practice from the year 1926. In ancient India, women were not allowed to see any male doctors. Okay, male doctors, many people in the rural area, they will not allow women to see the male doctors. So that's why Dr. Eda Sophia opened Christian Medical College and Hospital at Vellore to train only women doctors, so that they are qualified care providers, will give a proper care to women. Okay, for many years these hospitals only had Anglo-Indians. Okay, there were hospitals but no Indian nurses were training here, only Anglo-Indians were training. So for many years Anglo-Indians were training. So it was only in the year 1872 that Indian Christian nurses were trained in Delhi. They started the Indian communities. Okay, different Indian community students were also started the courses or to join in the nursing colleges. After independence, what was the current scenario of the midwifery in India? On 15th August 1947, India became independent and some social changes took place rapidly. Okay, very fastly social changes started to take place. Okay, but an alarming absence of public health. Okay, here there was no proper public health and sanitary measures continued. Okay, so the ratio of nurses to patient remained dangerously very low. Okay, the ratio here, the patients are increasing but the ratio of nurses were decreasing because there were no training, there were no proper colleges increased in India. So because of that reason, so here the ratio was dangerously low. The formation of many commissions and committees established by Government of India in the nursing education. Okay, there were many committees which started. Okay, the following health committees contributed as follows. In the year 1946, Boer Committee reported that lack of skilled services by qualified midwifery. Okay, here there are no skilled services are not provided by the qualified midwiferys. They got to know. They reported that playing important role in reducing maternal and infant mortality rate. Okay, so here maternal and infant mortality rate was reducing. Okay, it was playing very important role in reducing that. So here they started skilled services by qualified midwiferys. Okay, in year 1955, Shetty's committee recommended training for ANMs for better MCH services in healthcare. MCH is Mother and Child Health Services in healthcare. They started to recommend the training for ANM staffs. Okay, then in the year 1959 to 61, Health Survey and Planning Committee recommended MCH services as integrated units and started services like immunization scheduled. They have started all over the country, and also nutrition which is given by the government. Okay, in Anganwadi and in the various, like going to home and giving them what supplementation should be given for the women or children, or they used to advise them. Okay, so immunization, nutrition and education of mother was started from Health Survey and Planning Committee from the year 1959 to 60. In the year 1974, Kartar Singh Committee recommended family planning services and multi-purpose workers. Okay, here family planning services also they have started from the year 74, and multi-purpose health workers also was started from the year 1974. In 1975, Srivastava Committee recommended medical education for paraprofessional and manpower strengthening. Okay, here medical education they have started regarding paraprofessionals and manpower strengthening. Manpower is very important in the health sector to improve those manpower. So they have started this Srivastava Committee. And also in 1986, Bajaj Committee recommended health, manpower planning and management. Okay, so here, as already I have told in Srivastava Committee, that manpower strengthening is very important. So same as that in Bajaj Committee also, Bajaj also have recommended that health, manpower planning and their management is also necessary in the midwifery care in India. So thanks for watching. Please like, subscribe and share my channel.